Hospital workers of Reddit, what happens there that's hidden but that we should know about? An ambulance ride is not a one-way ticket to the front of the line. You still get triaged and could be rolled right to the waiting room if you're non-emergent. Sometimes when people die, we just put an oxygen mask on them and wheel them through the corridors. Less distressing for other patients and visitors to think they are asleep rather than see a body with a sheet over it. That patient families will do anything to keep the patient alive for their own comfort instead of abiding by the doctor's orders. For example, feeding an intubated patient a hamburger because he's hungry when they are already getting too fed and ordered not to interfere with the vent or track. This has resulted in many patient deaths than you think. I am an ICU nurse. I had a patient who was declared brainstem dead. The family did not want him to become an organ donor, so we withdrew treatment. I switched off the ventilator, pumps, etc. and extubated the patient. A few moments later the patient displayed Lazarus sign, which is a reflex that causes the patient to raise their arms in the air. I was by no means new to the role, but this really scared me as I had never even heard of it, let alone witnesses it. If you come into the drunk, there is guaranteed a pool of bets on your blood alcohol level. Possibly with odds if there's a pharmacist available to do the math for us. In most older hospitals, the pharmacy is just a couple of feet away from the morgue. I help patients to the bathroom non-stop all day. The amount of patients that just leave the bathroom without washing their hands is disgusting. If I didn't hear the sink or soap dispenser, your ass is getting led right to an alcohol hand station. You are doing your 90-year-old grandmother a great disservice by making her a full code. She will not survive CPR and her death will be significantly more traumatic because of it. Some families reject death so much. They beg the doctors and nursing staff to do life-saving measures on their 95-year-old grandma who has cancer everywhere and is begging for death. It's just unacceptable. We don't care what your dick, vagina, boobs, etc. look like. I have seen literally thousands and can't remember any of them, except for the one guy whose dick tip was touching his knee. In the ICU you spend a lot of time keeping corpses alive until their family comes around or their body gives out. Oh, Jesus ain't ready for her yet. Quote, yes, Jesus is ready for her. We're just actively delaying it. I got a fast bleep, i.e., drop everything you're doing and attend this emergency please. One night to a side room on the ward to find no patient in the bed. Was just about to leave the room and go back out to the nurses' station, where there had been a bit of a hubbub when I dashed past the first time. When something caught my eye. Looked up to see a face with wide, slightly wild, psych eyes, peering down at me from a gap in the ceiling tiles. She was a lady waiting for a bed in the psych hospital who'd clearly thought the ceiling was the best place to hide from the people trying to poison her. Honestly can't think of another occasion that I've been quite so terrified. Worst thing was that I had to walk, back out underneath her to get help from the nurses and security to get her down. The hospital I work at has these big square covers. When I first started, I would see transport staff pushing these things around the halls. I thought they were food trays or large boxes of hospital equipment. Turns out it's a structured bed cover. So when they are transporting a deceased patient to the morgue, it doesn't look like a person under a sheet. Hospital lab worker here, not particularly scandalous. But most people don't realize their lab tests are just very accurate guesses and have an error range. When we say your X is 10 grams per liter, we might actually mean it's 10 grams per liter plus or minus 1020%. I see too many people get extremely worked up about small fluctuations in blood test values that aren't actually in excess of the reference change value, and so technically aren't genuinely different from a previous value. Edit. If you're interested, have a little play with this tool to see how variability affects things. Double edit. Also, interlab variability is a big problem. Check out this interlab comparison data for estradiol. Identical copies of 3 samples sent to 230 labs around the UK and tested using all our various different machines. As you can see, none of us could agree on an answer. Only that the true value was somewhere between 100 and 200. Probably about 130. Not really hidden and kinda minor, but I'll say it anyways. I deliver food to patients and it's not hard to tell when someone is on their way out. Could be simply not being hungry, or could be the inability to eat. Had one patient who hadn't eaten anything off their tray for 3 days straight. The last time I delivered to them, they smiled and gave me a wink. Next day, they were gone. It's rough seeing these things happen in real time. I'm a grown-ass man who doesn't cry often, but it always leaves me feeling extra empty picking up the untouched trays and replacing them with another tray that I know will stay untouched as well. Surgeon here. We listen to music in the OR. Most people seem surprised when they hear that. If you sit there on your phone the whole time the mother of your child is in labor such that a nurse has to step in and fulfill the supportive role instead, yeah, everyone knows and you're getting judged by the whole unit. It's not uncommon for families to abandon elderly members at the hospital. They will straight up ghost or at least will be polite enough to say they won't give any assistance to us in placing them in a nursing home. So Adult Protective Services will get involved and make them a ward of the state. This process can take weeks to months. So these abandoned people just live in the hospital and take up the resources that could be used treating sick people. There are also many families that keep elderly members in unsafe living conditions so they can continue to take their social security checks for personal use. I know one. I used to manage hospital laundry services. Medical waste, body parts, etc. gets accidentally thrown in the laundry more often than you'd expect. Also needles and all sorts of other medical devices and personal items. Once we even had a deceased fetus come through to the sorting facility. People abusing nurses, and when the nurses report it, nothing happens. Nurses deserve safety and the attackers deserve accountability.
If you enjoyed this video, please check out our playlists full of similar content. Epicaricast is like doom scrolling for your ears. Please like, share, and subscribe.